Andrew S. Feldman, white-collar defense attorney representing healthcare providers and healthcare sales and marketing professionals nationwide. I want to talk today about COVID-19 fraud cases and the government's prosecution of laboratories and pharmacies for COVID-19 fraud. The government believes that labs in particular have billed the government program for the uninsured, also called HRSA, millions and millions of dollars for medically unnecessary or fraudulent PCR and rapid tests. How is this possible, though, when the government told us test repeatedly during the pandemic for years, even when we were asymptomatic? Test to travel, test as part of your job, test if you're an athlete preparing for a competition. Test. Let's talk specifically about PCR testing for COVID and how the government believes the fraud was committed. Theory number one. If you had a second test that needed to be ordered by a doctor or other healthcare professional, and if the lab billed for that test without that order, it was either fraudulent billing or improper billing. This theory is ridiculous. Ask what the rules were or what the laws were that obligated the lab to obtain a doctor's order. You're going to find that, except for Medicare, there really were no rules. And Medicare still pays for medically necessary tests. You're also going to find that if you were actually in the pandemic, that there were no doctors or healthcare professionals at drive-thrus or pop-up sites, and this is just a fictional universe. Theory number two, the PCR test for the patient was medically unnecessary and was not used to manage the symptoms or treatment of the patient. This is probably my second favorite. Is there a reasonable doubt that COVID tests were medically necessary? No, of course not. They were all medically necessary. You didn't even need to have symptoms to test for COVID. Theory number three, the PCR test that was approved was not a test that had obtained emergency use authorization from the FDA, and therefore it was not a valid PCR test. Quite frankly, this theory is just too complicated. The FDA rules from 2020 to 23 changed constantly, and just because the FDA's view of the test is one thing doesn't mean that that test is not reimbursable, especially if, wait for it, it was a LDT or lab developed test. Last but not least, number four, the government also frequently alleges in these cases that the labs used pop-up sites or tents to test uninsured patients, and those sites were getting kickbacks to refer the patient samples to the lab. They typically allege that the fee that the folks managing the pop-up sites received was a kickback. Problem with this, of course, is that the government actually said during the pandemic that they would not view payments for collecting, storing, and sending samples to labs as kickbacks. This makes sense because the site is performing a service. A trained professional is collecting a specimen, storing the specimen, and then arranging for it to be delivered to the lab for testing. There's a cost associated with this labor and a fair market value for this service. It's simply not patient recruitment or kickbacks, no matter how loudly the government says it is. Until next time, Andrew Feldman, white-collar defense attorney representing healthcare providers and healthcare sales and marketing professionals nationwide.